Good morning, Northwest Indiana. We are Veterans Views. It is 0900 on your clock this morning. This is Veterans Views radio show, award-winning show, and we are here with you for the next hour. We want to welcome you to the show, and we have a good show for you today, as always. And with me today is my co-host, Steve Bramer. Good morning, Steve.
Good morning, Donna. How you doing today?
All right. And we had a meeting last night with the Purple Heart organization here in Hammond.
Yeah.
721?
721.
721,
yep,
yeah. So I got to go to the meeting, and they kind of looked at me funny because I'm not a combat veteran. So one guy asked me if I was in Vietnam, and I was like, maybe I need to start coloring my hair again.
You know, it's funny, too, because it's a small group.
Yeah,
so they
it
get
is.
like 7-8 guys at a meeting.
Yeah.
So when somebody new comes, they start questioning.
Oh, that's okay. That's okay. I didn't mind. You know, they want to make sure that you're supposed to be there.
Yeah.
You know, and I appreciate them letting me come to their meeting and experience it.
And what a storm after that.
Oh, my God. Did you see there's damage? And, you know, my heart goes out to anybody whose property was damaged, whose home was destroyed. I mean, it's terrible that what these people are going through.
Yeah.
You know, you're sitting on the couch watching TV or something, and next thing you know, your roof is flying off.
Yeah.
You know, it's terrible.
Some houses got leveled.
Yeah.
In Merville.
Yeah, there's power lines down. There's trees down. I seen one thing. Please do not go around barricades. There was one car that went around a barricade and got damaged. He couldn't move because the guidelines that are on like telephone poles to hold the poles steady went right through his window.
Oh.
So luckily he wasn't hurt, but
He's lucky.
he went around the barricades, and that's why that's why they put him up.
Yeah.
You know, and don't go near any live power lines because you think you're going to move them. You're not. You will because what happens when you get electrocuted is your body just seizes up and you can't move.
Yeah.
And then next thing you know, your buddy's grabbing onto you to pull you off the power line, and they're the same way.
Oh.
Yeah, so you know, stay away from those power lines, and you know, and any down trees. It's going to take a while to get all the power back on and get everything cleaned up so people can move freely. Just be patient with everybody out there working. They've been working all night, and you know, they're working hard to get everything back to normal, and it's just going to take some time.
Yeah, some people don't have power.
Right.
Some,
yeah. So
got some flooding. So.
Yeah, it's pretty bad. I saw the news at one time between all of Chicagoland, there was at least 13 tornadoes at one time.
Wow.
Yeah.
Really?
Yeah.
Last night?
Yeah, that includes Chicago. Maybe they weren't technically tornadoes. Maybe they were just funnel clouds or something. But strong winds. The winds were over 70 miles an hour.
I mean, I believe it. My brother lost power up in Chicago west suburbs, and then you guys said.
We had a lot of people who didn't have power till they were supposed to not have power till Saturday, then just came on. But we still know people who don't have power still.
Yeah.
Yeah.
Wild.
That's unfortunate.
It is.
Especially in the heat.
Yeah.
Oh, yeah.
Oh,
Luckily, it's not going to be humid. It's not supposed to be as humid today, so
Right.
that'll help. I mean, people are going to lose their food in their refrigerators.
Yeah.
It's just bad, you know, when these things happen. But you know what? You have to be prepared. You have to kind of plan, and you know. And I keep telling my sister, she has no power again, and I keep telling her, you got to get a generator. You got to get one of them Generacs that just switches over automatically. Yeah, they're expensive, but if you live in an area where your power goes out all the time, it's definitely worth it.
Yeah.
You know, and prepare. Get your food. Get you some food that doesn't spoil. You know, there's all kinds of companies out there where you can get dehydrated food and stuff like that, so you can still feed your family.
MREs?
Yeah, MREs work great. You can buy them online.
I don't recommend
You
MRE.
absolutely can.
Yeah, you can buy them online.
I don't know why you would.
I have some.
Oh my God.
You know, just in case.
You ever ever try them?
Yeah, I like to get them out and feed them to my nieces and nephews because they get excited because they think they're eating, you know, space food or something. But
Space
Do they
food.
enjoy it?
a little bit. You know, and I mean, we all had our favorites, you know.
Everybody likes the jelly and the cracker.
Oh, yeah, that's my favorite. But,
Yeah.
you know, I come of age, when I went to boot camp, we had the sea rats, which are in the cans.
Oh.
Which, you know, we had Vietnam-era sea rats.
I heard those
in
were
the 80s.
brutal.
You know, you had fruit cocktail. You could get anything you wanted with that can of fruit cocktail. Anything. If you needed cigarettes, whatever you needed, man, that fruit cocktail would get you whatever you needed.
It's like Skittles for us.
Yeah.
Skittles.
Yeah. So it was, it was a very tradable thing. But anything other than that, I mean, the peanut butter was, you wouldn't be able to speak for a while because it was so.
Oh, so sticky.
So yeah. And the crackers were just dry as like dog biscuits, But it was okay. It's what we had, so you didn't really have a choice. But
well, hopefully everybody had recovers from the storm.
Yeah, luckily there were no deaths from what I hear so far.
Right.
So
Yeah.
that's very good.
So we have some guests today.
Yes, we do.
We have one of our sponsors here, Family Dental. We have Laura, right?
Yes, sir.
And then we have Dr. Leeman. How you doing?
I'm doing good.
Gotta get
Good
closer.
morning.
To that, yeah.
I'm doing very good. How are you, Steve?
Good, good. Now you
Thanks
guys
for
have been
inviting us.
you guys have been a sponsor for a while now, and you
Yeah.
guys have grown immensely since that. I think you
Yes.
guys have averaged a new opening every year since we became sponsors.
We're trying.
That's right. The last few years, that's correct.
Yes.
That's awesome. Good. Congratulations.
Yeah, that's now I know that I've been to your place there in Munster.
Okay, great.
Yeah, and I always tell people it was minimal pain. I have some dental issues, but everybody was great. They worked with me, and going through the process of what I had to have done was, it was good. They explain everything. They go over everything. They
Yeah.
take the time to answer your questions, which some doctors don't. But they were really good there.
Thank you.
Thank you for that. Yes, Dr. Alemis has created the Family Dental Care Organization we've been around for over 40 years now. 8 offices open, the 9th is under construction in Griffith, Indiana, so that's very exciting. But you're right. Nobody is like waking up every morning like, woo, I get to go to the dentist today.
Right.
So exciting. So we've tried to build this space where we make it as comfortable as possible
Yeah.
for our patients to want to come in, want to get the dental care, get explanations, which is critically important. Why do you need it? What are your needs? Why do you
Right,
need it? What are
right.
the benefits? Why should you have it done? Because dentistry, unfortunately, or oral health, I should say, is very underrated.
Yeah,
Oh my God.
Vastly.
So underrated.
there's so many things that, if you have a toothache or something or a problem with your tooth, that it affects other things.
The
That's
whole
right.
body, yeah.
Yeah, you want to talk about that a little bit, Doc?
Well, yeah. Well, I've written a book on it. It's health and its relationship to oral cavity and how it affects the mouth.
Okay.
And in fact, there was a couple. I read a couple articles the other day that they copied all of my information. I had. Anyway, I didn't get any credit for it, but.
That's how it always happens, isn't it?
Yeah, but everything that happens in the mouth actually it affects the rest of the body because all the inflow comes from the mouth, whether it be in terms of sustenance, nutrition, or in terms of like spiritual, like you talk, you communicate with your mouth, you smile, so it's all the expressions that it comes through the mouth. And if the mouth is under distress, then the rest of the body is under stress, and also mentally somebody's distressed. And it's the corollary is also true in terms of we see systemic problems by looking in the mouth. Somebody has diabetes, you can see how the gums are not doing very well, and you go like, "What's happening? Have you gone to your doctor lately?" Well, it's been a while, so why don't you check this out? You get a spontaneous bleeding, that's a serious problem, or you get, we see people that I've treated someone for years, and I kind of know how they're coming along, and next thing you know, they're just coming for a 6-month recall visit, and you go, "Whoa, what happened in the last 6 months?" Well, nothing. And then you find out there's stressful situations in their lives or something changed, mental or physical, and the teeth start breaking down.
Wow, that's fascinating. You wouldn't even think that your mental health affects your mouth.
That's right.
It-
And vice versa.
Or vice
I can
versa,
believe
yeah.
that. I can
Yeah.
believe that.
That's and I know we've talked I think the last time I was with you on you were with us on the show, and we talked about why is dental and vision separate from your health care?
That's a very good question. I don't know. I just think I think it's strictly a financial thing, or they're carving things out, or because the emphasis wasn't there. But it's something that I mean, look, they're patients who've had. I've had patients who have been treated with heart conditions or diabetes, and they're spending a ton of money on drugs, and then they come to see us, and we go like, wait a minute, you don't have no teeth to chew with. How are you gonna?
Wow.
What kind of nutrition you're gonna get in your body? So, and then we fix their teeth, and they find that they're gonna have to cut down their medication quite a bit.
Oh, wow.
It's like, oh, well, my doctor said I don't need all this medication for diabetes. Well, yeah, because you can eat proper food.
Oh, okay.
And when a person has distress in the mouth, then what happens is that they avoid things subconsciously without really knowing it. You got a nice raw vegetables, or you get you want to eat, or you want a nice steak, or hamburger is not that difficult, but then you avoid that subconsciously because you go, I can't chew on that, so you go for the mashed potatoes.
Okay.
That's the easiest thing to chew with, and that obviously you can't sustain yourself by eating mashed potatoes all day, every day. You know?
Right. Okay, that's a good point.
And to your point, Donna,
right,
we are
though.
very big advocates of dental being covered under primary medical.
Yeah.
It should be.
Oh,
because
absolutely.
Everything, as Dr. Alemis said, everything
Yeah.
does start with the mouth.
Yeah.
So you can't separate those two things and say everything in your oral cavity is not affecting the rest of your health. It's ridiculous. The American Dental Association is actually doing a push for that right now.
Oh, good.
On trying to get it covered under medical. But I know we've talked about this before, but you're talking let's specifically talk about with vets, right? So depending on what you look at, which is unfathomable to me, is it 15.8 million vets or is it 18 million vets in America? You can't really get the number pinned down, but it's somewhere between 15.8 and 18 million, right?
Right.
Out of those, 9 million are covered under VA Health. So let's say half. Out of those half, only 1/3, a little less than 1/3, qualify for any dental under VA Health.
It's hard to get dental under VA Health.
And then you have, in the entire country, including Puerto Rico, they have 200 VA clinics, dental clinics, which is not even close to enough.
Yeah.
Yeah.
And then out of that, you have 26% actually got medical care or dental care. It was 884,000 in 2025.
Wow.
That's the number of vets that were served by VA dental clinics.
Wow.
Out of 18 million.
Wow.
That's insane.
That's crazy.
I mean, that's insane.
So I have been chronicling my journey with the dental at VA for a long time, and for a while there, they were working on it around COVID time. They're working on it, and then it was like new dentist, new plan.
Right.
And each time it was a different plan. Each time it was a different person. So I'd go in for to start the plan that we talked about. Oh, that dentist's not here. Now you got to see the new guy. Well, now that's not.
Yeah.
But what I realized is I don't know. For me, dental is one. It seems like once it starts going bad, it can spiral really fast.
Sure.
I mean, it's sad.
It's very sad.
How fast it can affect you and hurt.
Right. So I was reading this article. It was on Stars and Stripes, just to give credit from where I read the article from.
Oh, I love Stars and Stripes.
So I think it's saying John Retzner. Am I saying that properly? Mm-hmm. He's the legislative director for Veterans Affairs.
Okay.
So he just presented in front of the House in May. So this just happened. And now they're proposing about 24 bills for dental.
Nice.
Under the VA.
Nice.
So nothing's passed yet. It's all brand new. It's all in, the legislative steps. But I do advise all your viewers to write to their congressmen, send emails to get some of these dental bills through.
Yeah.
But he made a very good point, which is what Dr. Alemis was also saying. And his argument was mental health, radiation therapies, all these different things that veterans have that they're going through are really deteriorating their oral health.
Yeah.
And when oral health deteriorates, everything else goes bad.
Yeah.
Yeah.
Very quickly. And it does, like you said, it spirals very quickly.
Yeah.
But he's doing a very good job pushing this, so I definitely recommend everybody getting involved.
That's awesome.
Yep.
And write your congresspeople.
Yeah. And if
Knock
you
on
want
some doors.
if you want to join in on our conversation today, you can call at 219
845
1100.
219
845
1100. Sorry, I jumped the gun.
That's
That's
all
my
right.
fault.
But you're
I like the cadence of it though. The cadence works really nice.
yeah. Which we try. We practice that.
Yeah, right. We get together just to practice that.
Yeah. But no, you're absolutely right. It's amazing how much better I feel because the dental office even got me into. I bought a a water pick kind of thing, and I use that every time I get in the shower now, and my mouth feels so much better. I never used one before, and so I was like, well, if I'm going to pay this money, I'm going to do what I got to do.
That's good.
Well, I'll tell you what, you can also go on our website, which is familydentalcare.com, and Dr. Alemis has a very good oral hygiene instruction video.
Oh,
Where
okay.
it shows the proper techniques for brushing and flossing, and you can find that on our website. Again, that's familydentalcare.com, and that will really show you the best techniques.
Okay.
But I also agree with you. I like the water pick in the shower.
Yeah.
And
Because
then
it's so messy.
It's so messy, but it feels so good.
Yeah.
Like when you're
and
done.
whatever you do, don't turn it off unless it's in your mouth. Lesson learned.
See, now I gotta use one. I never used a water pick before.
I got a cordless one. It's,
That's what I use,
Yeah,
too.
it's about this tall. And
What? Is
yeah.
this a thing?
Yeah,
Why
it's
nobody
cordless.
tell me? I didn't know that.
Well, when you come see us next week, you will.
Yeah.
We'll give you all the tricks.
Yeah.
All
Yeah,
right,
it
deal.
works really good, and the one I got, it's got, I don't know, 4 or 5 different settings. It's got a kid setting, a soft setting, a regular setting, which almost knocks me over. But so I have to use the softer one for now until I get a little bit stronger. But it works. I mean, it works good.
Well, that's another thing with toothbrushes too. If you want to explain that, Dr. Alemis, about hard bristles versus soft bristles, on what's better.
Well,
Yeah.
I'm an advocate of soft bristles because you got to brush. Basically, people think that they need to brush their teeth. You don't really need to brush your teeth. Your tongue takes care of them. And the saliva and the tongue takes care of them. What do you need? What you're really brushing is the interface between the teeth and the gums. It's where the gums meet the teeth. That's where the stuff gets in there, and that's where you're really brushing. And that's what you're
Okay.
after.
I've never heard that before.
So that's what you're after. That's what you're trying to
Yeah.
clean. And also when you floss in between, because you're going after the same thing.
Yeah.
So when you floss, you should go in twice, and go in one tooth. What do we call the sulcus, which is like the trough that is a little where the gum meet the tooth, and clean one the front tooth and go back again, and when the teeth meet. Where the teeth meet, and then you go for the back one and back and forth and take it out.
Okay.
That's what you're after. You're really not after brushing your teeth. You're after brushing where the gums meet the teeth.
Oh, okay.
So when you brush, you go back and forth. Half of the bristles on the gum, half the bristles on the tooth. So it gets that area. And when people have gum disease and we have to have periodontal surgery, the main reason you have to have periodontal surgery is because that sulcus, or the trough there, whatever you want to call that space, is got too deep, and the bristles can't get to it to clean it out. So you have to get the gums rearranged so that you can get that cleaned out.
Yeah, that's what I had to have done.
Okay, yeah. So and that's what you really, when you brush, that's where you're after. But I'm advocate of soft bristles.
Okay.
And I'm not a big fan of all this fancy toothbrushes. Just the regular old toothbrushes are just as fine. And as long as they're soft bristles, and you go back and forth, half of bristles on the gum, half on the tooth. And if you're bleeding, that means that you're not brushing well enough. If you're continuing to, the more you brush, the less you'll bleed. The better you clean your teeth, the less you'll bleed. And if that doesn't hold true for you, then you should really need to see a dentist because there's something else going on.
Okay. Okay.
I have a question real
Yep.
quick. When the VA is real big on root canals, and when I've had 4 root canals over there.
Sure.
But I've been reading lately that some people are saying that root canals is not good. What is your opinion on root canals?
Well, it's a little tricky to explain why they say that. The reason is because when we say root canals, we mean the tooth has teeth have between 1 and 4 roots, right? And those roots are cleaned out, and they're because when when you get a cavity all the way into the nerve, those it's not just the nerve, it's the artery, the vein, the nerve in there, and they die, right? So now you got to go in there and clean it out. We figured out, and it really took place, I don't know, either for ancient Egypt, like it's very thousands of years ago, that you could clean out the root, and the outside of the tooth still alive and functions. So although the inside is dead, the outside it can function. The advent of the technology of the root canals. So the root canals have been around for thousands of years. Yeah. So the technology's got better, where the stuff that we put in there is inert and doesn't break down, and we seal it over it. So it just sits there and it doesn't hurt you, it doesn't affect the tooth or your body, and everything is good. The reason they're saying that that people are against root canals is that it's not as easy procedure to do, and therefore, if there's still an infection in there, then it just sits there and just continue to kind of causes an infection in your head.
Yeah.
So, just to put a plug in for us, we have all root canals done by our specialists. They're specialized in a particular area. And we also have microscopes, which they see the tooth is magnified by 10 times.
Wow.
So they can they do the best possible root canals. Also, we have the microscope is like $40,000 scope, and how many do we have of those? That's
a lot.
That's ridiculous.
That is a lot.
7.
Wow.
7 of
Yeah,
them.
that's ridiculous. Anyway,
Yes.
and then we have what's called a CBCT, which is like a 3-dimensional X-ray, so they can actually see if there's an infection there.
That's
So
awesome.
by doing all that, it eliminates that possibility of having an infection, or at least it makes it a lot less. And there's a lot of root canals. All root canals, they do have continued infection. Your body just keeps fighting it off, and that's what people say. Hey, you shouldn't really do that. I do agree. I think when you have a root canal has an infection in it, you should retreat it or pull the tooth.
Yeah.
Because it's not good for you. At the same time, even the people who are against, I have 3 root canals in my mouth. I don't want to lose the teeth. At the same time, though, there are people who say, well, I'm not going to do a root canal because of X, Y, Z reasons, but then they have other infections which they're not taking care of, what's affecting their mouth.
Yeah. And those infections could be bad.
Yeah.
That's right.
And infections can spread too, can't they?
Yes, it affects the next teeth, or it can affect your whole body. And everybody's different. You can get some people that really affects their body. You see people who have a lot of infections in their mouths and doesn't affect them, but other people it affects them quite a bit.
Yeah. Wow.
So, but regardless, an infection 2 inches away from your brain is just not a good thing.
Yeah.
That's a very good
Exactly.
point.
That's
very
a
good
very
point.
good point, actually.
Yeah.
Yeah.
So just take care of it.
We have a caller. Go ahead, caller.
Good morning, G.I. Joe, G.I. Jane, citizen soldiers, and commanders, and dental guests.
That intro keeps getting bigger and
Yeah, it
bigger.
does. Good morning, Ernie.
Ernie, good morning.
That was a mouthful. Well, this is former commander of American Legion Post 168, Hammond, the Victory Post, celebrating its 95th year. And having said all that long introduction, I wanted to talk a little bit about Flag Day, which does and doesn't have to do with your guests. However, it ties in because a good smile, when you have the United States of America celebrating Flag Day Monday, is very important. So because of the dental crew you have there, they can give you a good smile and
Absolutely.
show off your teeth and how proud you are of our country, which leads into why I called. And having said all that, I did want to mention about it and then read a little excerpt, and then you can get back to your show. But Flag Day is Monday, as we all know, and you know me with about let's be right about flag etiquette, and I wanted to just call in this morning. And this began in 1861, and Flag Day was observed. I wonder if they had dentists back then, and what kind of dentistry they did back in that day. Speaking of, the great guest you have this morning. But before you answer that or talk about it when we hang up, I guess I just want to read this and then let you move on with your show. A little bit about Flag Day Monday, and the thing is encouraging everybody to fly your flag, honor your flag, and remember the importance of our flag. So Flag Day serves as a reminder of the nation's heritage and the values represented by the American flag. From its origins in the Revolutionary War to its establishment as a national observance, Flag Day embodies the spirit of patriotism and unity that continues to inspire Americans throughout the efforts of dedicated individuals and the collective recognition of its importance. So Flag Day remains a cherished tradition in the United States. So in conclusion to all of that, I just wanted to remind everybody about Monday and Flag Day, and please fly your flag. And as you've talked about in the past, and I think Steve has even mentioned, riding around town looking for businesses and homes and places with worn, tattered, shattered, and non-usable flags. And so this is a perfect time for everybody to replace their American flag and honor our country. So with that, what do you think in 1861 they had a dentist?
So, Dr. Alemis, the question is, in 1861, what kind of dental work was going on then?
1861?
Yep. And I agree with you about flying your flag on Monday and smiling with it.
There you go.
Thank you. Well, I'll let you get back to the show, Steve and Donna, and you're doing a great job.
Thank you, Ernie.
All right, thanks, Ernie.
All right, have a nice weekend.
You too.
Fly your flag.
All right.
Toodaloo.
The only data I have is from all Western movies where basically you got a lot of whiskey and the professionals combined with hairdressers and
Did they really?
There's a pharmacist, a hairdresser, and a dentist, all combined in one, I guess.
I'm
Wow.
kind of surprised when you said that they did root canals in ancient Egypt.
Yeah, because they had figured out. It was in Europe too. They were just at I'm talking like the ancient times, like 3000 BC. They figured out that they can go in there and clean out the canal, and the tooth was able to function.
It's crazy
amazing.
to think of them doing that without the technology that we have today.
Oh, right.
I mean,
Yeah.
can you imagine the tools that they had to do that with?
Well, yeah.
Or imagine the poor guy who had to have it done then.
Yeah.
Yeah, because I wonder if I bet they didn't have Novocaine then.
They
I
probably
guess
didn't-
where he's talking about
true.
going
Yeah.
in the Westerns, shot of whiskey and
Yeah, there you go.
getting yanked out.
Yeah.
Ooh,
That's
man.
right, yeah.
Okay.
Ooh, unfathomable.
Yeah.
I mean, really.
I don't even want to think about it.
Yeah.
It feels weird, if you've never had a tooth pulled and they pull that tooth, you can feel it wiggling
Yeah.
a little bit, and then they yank it out. It's like, oh,
Yeah.
it just feels weird, and then your mouth takes a little time for it to adjust. Your tongue is like looking for that tooth or something.
I think anything you have done takes a bit.
Yeah.
It just takes a bit because you're so used to the feel of your mouth
Right.
that even getting like a filling done takes a beat to get used to it.
Yeah.
But that's why you come to us, because we have fantastic dentists.
Yes, you do.
And great technology, so you don't have to worry about what they were doing back in. We were not going to give you a shot of whiskey, but
Probably wouldn't hurt,
But
You can do that before you go.
Yeah.
Can you
right.
imagine?
Yeah. Ooh, no. So let's talk a little bit. Does it matter what kind of toothpaste you use?
Well, it just depends on your preference. I don't think it really matters that much.
Okay.
I just think it's just as long as the key thing is just when you see a dentist every 6 months, just say, look, here's what I've been doing. That's one of the things that as a dentist, I like to say to our patients is tell us what you're doing. Tell us how you feel. Tell us what it is that what are you trying to accomplish.
Okay.
Because sometimes we have to pull it out of people like, well, what changed so much in the last 6 months? Well, I don't do anything different. Well, you have to be switching around something. Mm-hmm. Well, yeah, I drink 2 Cokes a day. Well, well, that's a big change.
Yeah.
Or I'm under stress and I'm eating those lemon drops or whatever. Mm-hmm. And well, that's a big change. But yeah, it's just like make the dentist responsible for like, hey, here's what you taught me. Here's what I'm doing, and I'm doing it constantly. Why are my gums still bleeding?
Yeah.
Okay, and whatever. But that's as far as like you said about toothpaste, are you getting the results?
Okay.
If you go 6 months and the hygienist says, gee, I didn't have much to do here.
Okay.
Well, then you're doing a good job.
Yeah. Gotcha.
Yeah.
Okay. All right.
We got a caller.
Hello, caller.
Hey, from the powerless bunker in Hobart, Indiana. How are you guys this morning?
Hey,
Good.
morning,
How are
Joey.
you out there in Hobart?
Well, Jack. Okay. I mean, we have no power and stuff like that, and it was a really rough night. I didn't get no sleep at all. I just couldn't sleep with everything going on, and everything's all dark and squad cars going just back and forth patrolling and stuff like that. And the funny thing is that the neighbors across the street, they all have power. We have no power, so I don't know I don't know how they divide the quad or the grid or whatever and stuff like that.
Yeah.
It's kind of crazy and stuff like that. But anyway, I wanted to call and let you know that tomorrow's the second Saturday of the month, and we're doing our monthly veterans breakfast for veterans that we do on the second Saturday of the month over at the Cafe Cellulose in Maryville. As far as I know, they're still good. The only thing that I understand about Maryville was that, my daughter told me a tornado touchdown in St. John by Richardson's High School, and supposedly 1 touchdown at Adrian High School. You know, so that's what So, but anyway, as far as I know, everybody else in Maryville is up and running on 30 and stuff like that. But anyway, we're going to be there tomorrow morning, 8 o'clock.
Okay.
Cafe Cellulose, 7454 South Broadway. Come join us 8 o'clock in the morning. Bring another veteran with you, and nice to have a breakfast and some camaraderie and stuff like that. And,
Okay. All right, Joe.
Okay. I just want to tell my buddy there that he promised to come this time and stuff like that. That's your alarm, okay?
I was wondering how long until you brought that up.
No. I mean, I haven't much sleep, but no, you did say you were gonna, give up your seriously. So come on, join us tomorrow morning, okay? All right.
All right.
All right.
Thanks, Joe.
All right. You guys have a good day.
All right, you too. Stay
Bye, guys.
safe. All right.
I read a thing that they were saying that dentistry has gotten so bad in Britain that people can't even go to the dentist because either it's too high or there's not any dentists
Like the
around.
cost is too high?
Yeah.
I haven't heard that. That doesn't surprise me.
Yeah.
However, we did, many years ago, we were talking to a dentist from London, and his income was like $45,000. Like comparable
wow.
to ours, $45,000 a year. That was a few years ago. It wasn't 10 years ago. It was a few years ago.
Yeah.
So if that's still the case, I can see. I mean,
can see why.
Wow.
Yeah.
I don't know how much it costs in the UK, but going to dental school is extraordinarily expensive. So to get paid $45,000 per year is not going to fly with what you have to pay back in loans just because it's so expensive. But I will say, going back to, we were talking about this, I think, before, with how do you incentivize, because everything's with the government funded when it comes to the VA, right?
Right.
So how do you incentivize having dental covered and putting it more in the health plans for the VA? And I think this kind of goes back to, what is the incentive for dentists? Like you're saying, your personal experience is the turnover, the constant new dentist. Actually, one of our hygienists also works with the VA, and they continue to cut her hours there.
Oh,
so
man.
now you're servicing less. Why?
Yeah.
I don't know. My guess is the funding.
Yeah.
What Steve said was that's really true throughout the industry. It's like one of the ways to save money if you're an insurance company is by creating confusion.
Oh, okay.
So, the confusion slows things down.
Yeah.
So if anything that slows things down, it slows the dental treatment down, slows the payments down. So that's part of it.
So it's funny
Yeah.
you say that because that is exactly how the VA operates with community care. Because
Yes.
there's a system. You have like 48 hours after you go to the doctor, but you could turn in the bill. Okay. Well, what happens is the doctor or wherever they went gets impatient, so they send a bill to the veteran. Even
Yeah.
though they're going to get paid from the VA, they still send a bill to the veteran. And, you know, the VA still pays them. The veteran's paying them. I mean, it's just,
It's crazy.
yeah, it is
Yeah.
crazy how they work.
I think they should have a system where if dentists are willing to say, I'm going to dedicate 3 years to, let's say, the VA,
Yeah.
they get tuition reimbursement.
Yeah.
They do that with lawyers for specific things. They do that with medical doctors for specific things.
They should.
That's what I think would really help.
Yeah.
I agree.
Because if you have more dentists who are willing to do it,
Yeah.
then you can take care of a lot more patients.
Right.
Oh, God, right?
Right. And
Obviously,
you know, and,
right.
and sadly it's not just that it's not just dentists that change all the time. It's mental health, it's the doctors.
Yeah.
You know, they get transferred to another VA hospital or whatever.
I mean, I
and-
think the VA is like the biggest internship,
yeah.
honestly.
Oh, that's
Yeah.
a good way to say it.
Yeah.
Yeah.
Sure.
Yeah.
I mean, it's just crazy. They're all students.
Sure.
Yeah.
My wife is eligible for what's called Champ VA, which is the health insurance the VA gives to a spouse of 100% veteran. And dental is not in it. She gets like a discount with Delta Dental. And it's like that's indicative of what we've been talking
That's right.
about.
Yeah.
That's
you
right.
know?
And it's probably not that much of a discount either.
No. Not
It's
at all.
probably not.
Yeah, and then you have to look at it too is from a patient point of view too is dental has such this caveat or whatever you want to call it over it, like, I'm not going to the dentist, I'm scared of the dentist, and I think that starts when you're a kid,
Right.
and because maybe your parents didn't take you. My parents never took us, to the dentist. When I was in school, we had this thing called the toothpaste test, and we sat at our desk with this little bowl of water. And we had to, you brushed your teeth with this. Oh my God, it was like sandpaper. It was terrible. I didn't hold down my lunch that day. But anyway, it was bad. And then you brush your teeth. After that, then you brush your teeth like you normally do. Then you eat this red tablet. And it's supposed to show all the spots you missed.
Right.
And that worked, and you look in the mirror and you're like, oh, wait, I know I brushed there, So I think that they used to do that in the schools. I don't know if they do that anymore. I doubt it.
No.
But, that taught you that, I need to brush a little bit better
That
than
is a
that.
great way.
Yeah.
I can't believe they
They
don't
do
that
have
anymore.
a lot. They have those options for kids. I mean, I guess adults could use them, but for kids, they have it.
Okay.
And they also have like timing toothbrushes.
Oh,
So,
okay.
but it will like show your we give it away to
Okay.
the kids, but I think it shows blue on what you missed.
Okay.
So same kind of concept.
Yeah.
Okay.
But I agree with you on the education part of it.
Yeah.
So, and I don't think that we're educating enough at the younger ages, and especially if you have a bad experience at the dentist when you're a kid, it takes a lot to get back. Like
Yeah.
my mom has a very,
That's true.
very unique experience with the dentist, and she said Dr. Alemis, when she saw him for the first time, like 20 some years ago, that he was the first person who ever said anything nice about her teeth.
Oh,
And
wow.
she has a lot. She had a lot of problems, but
Yeah.
Dr. Alemis was the only person. 20 years later, she still talks about it.
Do you know that's why my wife
I mean,
is scared to go to the
Sure.
dentist now?
Yeah.
So I was telling Laura, my wife she had 4 daughters. Each pregnancy was worse than the last. And the last one, it was so bad that even drinking water, she would throw up. I
Wow.
mean, it was just nothing but constant throwing up.
Wow.
And it by the 4th one, her teeth were just so deteriorated, they were just practically falling out. So it was really sad, but we
very sad.
didn't have no insurance, so it's like there's not much you could do.
And why shouldn't something like that be covered under her medical?
Yeah,
Because her pregnancy is medical,
I know.
and that caused a breakdown in her teeth.
Man.
So
Yeah.
why shouldn't those two things correlate
Yeah.
and get covered? Same thing obviously I'm not a doctor, but there's a lot of medications people are taking. And like Dr. Lima said, maybe they don't even need to take them anymore if
Yeah.
they have good oral health, but also that medication is deteriorating their gums and
Yeah.
their teeth, and that's directly causing their their problems. How is that not covered?
Yeah.
Yeah, you get some patients that they want $100,000 surgery of some kind, heart surgery or whatever, and then they come to us and it's like, okay, well, do you don't have any teeth? No, I don't. I only have 3 teeth. I remember several people like that, and I go like, so they spent like $200,000-$300,000 doing
Right.
all this stuff when you can't eat.
Yeah.
How
Yeah.
are you going to sustain your body? What is it? What exactly are you eating? You're not sucking through a straw. What is that?
Right, right.
So that's sad because
Yeah.
that should have happened at the same time as they were exploring the problems that the person had. One of the problems is like, hey, you got no teeth, you can't eat, so let's fix that in addition to whatever we're fixing your heart, in addition to fixing your diabetes, whatever.
Right. Right.
So that's a problem. So another thing I like to say in terms of like, just not for the veterans, for anybody, that teeth show a certain amount of, I don't know how to say it, it's like a certain amount of class or a certain amount of like, if you have beautiful teeth, they make you look smart and more better looking, you know? And that whether you are or not is secondary, but that's what happens. It's sad to me to see somebody who's like fought for the country or to care of the rest of us and be safe, and now they walk around without teeth, and it's just not. It doesn't look good, you know. And they don't feel good having that problem. So it's really important to get that fixed. But I do agree with Laura; they should be covered with the medical insurance.
Right. Right. Absolutely. So let's talk a little bit about TMJ and the jaw clicking, because I have that. Sometimes my mouth doesn't open, all the way. And my niece's daughter has that as well. And she's only, what is she, 10, 11? She already has the jaw clicking. So what exactly is that?
Well, TMJ stands for temporomandibular joint. This is like the top of your head, or like where your top teeth are, is like the temporal bone. That's what the name of it is. And the lower, which the jaw that just opens and closes, is the mandible. So the joint is what's in between the joint that holds them together, right? So it's a bunch of ligaments that are holding the lower jaw, or the mandible, and that's what goes up and down. Where you see that cartoon, it says, "What's up, Doc?" They make it. They both parts move, right? But in your head, only the bottom moves.
Okay.
Not the top.
Right.
So the joints are holding the lower jaw together, and that's how you open and close it. And obviously, your muscles, that's what makes things work. So in between that, there's a pad, and that is like a little pillow, and that pad just helps cushion everything. There's a lot of synovial fluids and all that in there that helps lubricate the joint and make things work well. So the joint works well to the degree that your teeth close together properly. If there's, let's just say, if I was to put a crown and it was 2 millimeters open, the whole jaw is pivoting against that, and you're biting hard to chew your food, and it's really putting unnatural pressure in that particular part of the TMJ, with the right or left area where the crown was put in there. I'm not. When I say crown, it's like you lose your tooth and the teeth move, and now it's in what's what we call hyperocclusion. The occlusion meaning the bite, and it hits first, or the wisdom teeth come in inappropriately, and then that's causing it to pivot back there. So now that whole apparatus, in the temporomandibular joint, in one or both areas, gets very stressed. Obviously, that could happen from also a hit in that area, a fall in your jaw, and pushes everything back. Difficult braces, difficult extractions. That could also, all these different things can cause problems with the apparatus in the temporomandibular joint. And unfortunately, we don't have easy solutions. You can't just take the pad out When you say clicking, what clicks is the pad is not sitting there nicely. It just pops out, pops in, pops out, pops in. That's what the problem is. And we don't have an easy solution. It would be nice to have a little surgery, go in there and clean it up and put it back in there and run with it. So what we do as dentists, and that's all we can really do, unless and it works 90% of the time, at least, is that we make sure your bite is perfect, and now everything back there starts to readapt. And it goes, okay, now we're not getting these particular stresses here. We're happy. And then just things calm down and adapt, and it gets better and better. If it doesn't happen, then we get a special X-ray of that particular area, and we go, what is this? What's happening there? Is it a fracture? Is it a tumor? Is it some kind of like funny resorption? What is really happening with the temporomandibular joint? That's 10% of the time or less, but 90% of the time we're able to get the bite straight, and it works out pretty good, and things calm down. You might still I haven't looked in your mouth, but let's just say once we get the bite straight, you might feel just comfortable and forget about, and it might still continue to click a little bit. It might not bother you. And the clicking might go away or might not, but it won't bother you. Things will get better and better. When patients come to me and they're in pain besides the clicking, what I like to do is I put them in a plastic night guard, and where it has a perfect bite without adjusting their teeth. And I go, wear this at night. So they wear that, and I go, how does it? It's like diagnostic. I said, well, how is that looking? How's that making it feel? Oh, that's so much better. So it really made a big difference because I wasn't grinding on this, or I was on my teeth, and now I said, okay, so that's a tooth problem. That's a diagnostic. So that's a tooth problem.
Okay.
Because I fix your bite in the plastic, and that's a tooth problem. So we go in the mouth and adjust the teeth, and we fix the bite directly, and then it just gets better and better. If the plastic doesn't make you feel better, then we look at other areas.
Okay. All right.
Nice.
So those are, and because we don't have easy solutions, it's really important to get the bite perfect, and once it's important to have your bite perfect to begin with, so that you don't stress the apparatus and you don't run into to those problems. And people are different. You have people who really stress, and they don't seem to. The apparatus holds together, the temporomandibular joint holds together, and there are people who are very little something, and it's like, oh yeah, it really feels horrible, and you're looking at it by and you say, well, you adjust a couple of things. Oh my goodness, I feel so much better. It's like, wow, it's pretty sensitive.
So you can have TMJ from just a cap being too big.
The cap being too long.
Or too long,
Yeah, where you're hitting it first.
Yeah.
Wisdom teeth coming in inappropriately.
Wow.
A lot of stresses when you have you're in a difficult extraction. You got hit. You're trying to do something crazy with your teeth, trying to open a can of beer or something.
Yeah.
You put a lot of pressure on it. When you're trying to crack a walnut, or you really hard. And just some people do things that just because it doesn't hurt, they press on it. We use the teeth for many different things than we should.
Yeah.
So
people ask me. Sorry to interrupt you. People ask me, they say, well, "What should I do once we make some new crowns or veneers, whatever?" So what should I do or what should I do? I said, well, it's only a basic rule. Anything that's going to go in your stomach, you can chew on. Anything that's not going to go in your stomach, don't chew on.
That's a good way of looking at it.
Yeah.
It's like the back of your pencil is not going to go,
Right.
in your stomach.
Or crayons, right?
Yeah,
Right.
So don't chew on it.
Yeah, I got you, crayons.
Or a shell of a walnut, it's not going to go in your stomach.
Right.
So don't chew on it.
I've seen electricians put the wire in their mouth to strip it.
Yeah, I had a patient that kept putting bonding with him, was trying to do veneers, whatever. He kept breaking it off, and I was like, what the heck are you doing? He goes, well, it falls off, doc, it falls off. I said, listen, my bonding doesn't fall off. I said, what are you doing? Well, he was a roofer.
Oh.
And he would hold the nails in his mouth.
Uh-huh.
Oh,
And
okay.
I'm like, that's not really what is intended to be.
Right.
Yeah. So
Oh, wow.
I want to talk to you a little bit about there's a lot of people that didn't have this knowledge, right? They've gotten older and they've already lost their teeth. What are the options for people who are in that position
To replace the missing ones.
or who, only have 3 or 4 or 5 teeth left?
Anything we can keep, I keep. Anything, even if it's just one tooth, it helps because the removable, like dentures or partials, they're not teeth. It's one tooth. You have a denture and you bite on one side, it pops on the other. You bite on the other side, pops on the other.
Okay.
So it's one tooth. Really, they're not teeth. There's one tooth.
Yeah.
So, and I've had patients where I kept one, let's say one canine, and they were like, "Well, why are you keeping this? Just take everything out." So it's a solid tooth. And what happens is like you're going to bite an apple, right? What do you think you're going to put the apple on? And now one tooth that's solid.
Yeah.
It makes a big difference.
Okay.
Okay.
So there is okay.
So you're removable, like dentures, partials that come in and out.
Yeah.
And you also have implants that you can replace everything with implants and bridges. And
Okay,
then
hold
you
on.
have-
What's a bridge?
A bridge
I never
is
heard of
when
that.
you have 2 teeth and one missing in the middle, and then you connect all 3 together.
Oh, so kind of like this one.
That's right.
Okay.
Yep, but it doesn't come in and out.
It's
Okay.
permanent.
It's permanent.
It's permanent.
And you
Versus the
Yeah.
denture, the partial.
even
it
if you
comes in
lost
and
all
out.
your teeth, we can do that with implants.
Right.
And nothing comes out.
So you can put a tooth here? The
Yep.
VA can?
Well, in your case, if your teeth are solid, they would be just it wouldn't need to be implants. We just do a bridge.
Right.
We have to look at the X-ray
Yeah.
and the other thing you could do is you could put somewhere in between. You have a denture, but you put a couple implants underneath, and it clips on, it clips off. You have a male coming out of your gums, and a female into the denture, and it clips on, clips off, and it's a lot tighter as opposed to being in a regular denture that is loose.
Yeah. What about eating wise for somebody who, for somebody who doesn't have a lot of teeth? Can you eat with dentures?
The more support you have, the better. If you have implants under the denture, you'll eat a lot better. But everybody's different. I mean, there are people who have dentures; they're just happy with them. They don't really want to do anything. Other people, they go like, "This is not going to work for me. I need to get implants." So it's every. But yeah, we have the key thing though is I want to stress is. Why does somebody lose their teeth, right? Because I tell my dentists, because the dentist didn't do a good job explaining to them when they said pull it. When there was a cavity, they said, hey, you just try to convince them to. Some people just like you said, nobody likes to go to the dentist, right? So you just figure it out so you can convince them to do it because it's like, hey, you're here, let's get this thing done. You got to me, if you get a cavity, if you have a filling and a crown, this feels no different than your own teeth. Once you let it go and it goes past that, your root canals, which is like, they're not always 100% successful. When you go to implants are great. I have 2 in my mouth. I was a teenager, I had a couple of root canals didn't work well. And, but an implant it integrates well with the bone, but in terms of the gums, the gums do not attach to the implant. So it just kind of sits there passively, and you just have to keep it clean. Mm-hmm. So it's like nothing is as good as your own tooth. So the idea is that like, hey, that's why Laura was saying like, medicine should cover that. Medical insurance should cover that. So people go like they don't have to pay money to come in for a cleaning and an exam. If you get an exam and a cleaning and little things that you need, then you're not going to get the big things later on.
Yeah.
And that's really what I would advocate strongly. Even when it comes to like public aid patients, I think pay real well for cleanings, fillings, and crowns, and that will really go a long way.
Okay. So I've seen a lot of it seems like easier ways to get implants, but it seems cheaper. It seems not so safe. Are those?
You mean what they're advertising on like YouTube and social media, and it comes up on your feed, things like that?
There's a lot of misnomers about implants. It's like when somebody says I want implants, is like it's a very simplistic question. It just varies. Like it depends on the quality of your bone. Depends how high or low your sinus is. It depends on your health. It depends if you're a smoker and you're willing to stop smoking or not.
Oh, you mean to get implants?
Yes.
Oh,
So it's not
okay.
like, it's not something like this board here. You say, well, how much is it going to cost to stick a nail here, right? Well, that's an implant is in some ways, right?
Yeah.
But this is, you know what this board is, and you know what it's going to do. Your mouth is a lot of variables.
Okay.
So it's if I leave one message today is that go to the dentist regularly and just make him responsible to make sure that you don't lose teeth. That's really the long and the short of it. Just say, hey, doc, I'm going to be coming here every 6 months, but I don't lose any teeth. What can you do for me?
Yeah.
And I just want to, just as a reminder, we give 10% off to all veterans at all of our locations. And you can find any of our locations, like I said, on FamilyDentalCare.com. But we give 10% off to all veterans, and all the diagnostics are at no charge. So the exams, the x-rays, basic cleaning, we'll do that at no charge, and any other service, 10% off.
And you guys, what was I going to say? Because you guys also take Medicaid, Medicare?
We take Medicare.
Medicare,
We don't
okay.
take the Medicaid. We do take the Medicare. And we have dedicated Medicare agents that anybody who has questions on Medicare, so if they're about to turn 65 or they currently have Medicare and they don't have dental covered on their Medicare, our agents can get them signed up at no charge.
Oh, that's great.
So if you come into any of our offices, we'll hook you up with our Medicare agent.
Oh, so you have
Great.
to do something different to get dental with Medicare? You don't
Yes,
just get it?
You don't just get it. You have to do an extra step, but there's no extra charge for it. The problem is it's all confusing. And
On
like
purpose?
Dr. Lemma said, of course it
Yeah.
absolutely is done on purpose, which is why we use our Medicare agents to navigate it for everyone, because
That's
it's
smart.
impossible. So
Yeah.
we let them do the work for our patients.
Right,
They
right.
do a great job.
They do an
It
awesome
really,
job,
really
yes.
helps our patients because it's like that makes a big because most senior citizens do not know that this even exists.
That's
Right,
So
yeah.
as soon as we look at somebody as like, hey, you're 65 years old, 64, you're about to be 65, talk to our agents, and
Yeah.
you guys can make a decision for
Right.
that. And it really, it's a big service, and Laura did a great job in hooking up with them.
And that's also just to make the point of, if you're disabled too, you also qualify for that at no charge.
okay.
yeah, it's
Okay.
So it's not just 65 and older. That's typically who's covered, but anybody who's deemed disabled
Yeah.
and qualify for Medicare, they can also get the dental, and most services are covered at 100%.
Oh, wow.
So, and
That's
then
awesome.
it's a great plan. I don't know how long they're going to keep doing it, but it's a great plan. So call us.
Yeah,
we'll
use
get,
it
we'll-
while you
That's
have it.
right.
Yeah,
That's
yeah.
right.
Use it before you lose it.
That's
That's
right.
right. That's
Yeah.
right.
Okay.
Exactly right.
So we got about 3 minutes.
Yeah, not much time.
Yeah.
One of the things I'd like to plug in terms of, like you said, you get a great service. I really thank you. Appreciate it. One of the things we're different about from other offices is that we do have, we do mandatorily train our staff 2 hours every week to outside of the office. Like we have 3 training centers.
Oh,
And we actually have three what we call trainers. You know,
Okay.
and we have manuals on how to handle customers, how to understand insurance, and with this, and they constantly train on how to improve our service to our patients. When you come into our office, you're like a level 0 where you start, and then it keeps on running the levels, different pay, and then you get to level 7 as an office manager. So it takes it's a whole standardized system of how to train our staff. We're not perfect, but that is what we do differently than most
okay.
facilities.
that's cool. That's
So
nice.
we're on last call now.
Okay.
I just wanted to tell you, ever since I met you guys, I started something with my family where we all brush our teeth together at night.
Ah,
good.
Make
That's
sure that the
awesome.
kids do it, because I didn't realize how important dental was until we started talking to you and you started explaining some of this stuff. You know, it's something that could be overlooked very easily. So
Yeah.
thank you guys for coming in.
That's a
Well,
very
thank you
great
very much
idea.
for
Great
inviting
job.
us.
Thank you.
Thank
Seriously.
you. It was fun.
yeah.
Yes,
I'm glad you got.
it's always a blast.
Yeah, yeah. We like having you guys. You guys give us so much information, and we can pass it on to the community as we go. As you know, we talk about our sponsors every show, and You guys, of course, are always in there, and we appreciate you keeping this show on the air.
Yeah.
Absolutely.
You know, that's not always, you know, without you guys, we wouldn't be here to
And
do,
we
you know.
appreciate the all the people in the military that keep us safe and continue to do what we're doing instead of us being in the military.
Yeah, it's not for everybody. There's nothing wrong with that.
Well, Laura, you know, you went to two brothers.
brothers,
Yeah,
yeah.
there you go. So
Do you have
Yes.
any final words?
Nope, just like I said, we definitely, we've had a lot of your audience actually come in.
Yeah.
So I thank you for that because that's been a very good partnership and we want to continue that partnership,
Yeah.
which is why we offer that discount. And anybody who needs help getting hooked up with good insurance or any kind of coverage, we'll be happy to do that for you.
Yep.
And again, like I said, we have the agents, but come in, get the discount, go to any one of our offices, they'll honor it, familydon'tcare.com.
Awesome.
Yep.
And it's
Thank-
always so much fun coming here. I really appreciate you guys.
Doctor,
Thank
do you
you.
have any anything you want to leave us with?
well, I just want to like to thank the veterans for what they do. Like I said, we appreciate it because without you, then we would have not be safe and to maintain this democratic and free enterprise system is really it takes a lot, and you have to constant alertness.
Absolutely.
Yeah, thank
Absolutely. You know, and if I could just make one recommendation, a TV on the ceiling when you're leaning back would be wonderful.
That would be distracting,
It,
right?
it distracts you, you know. I mean, you know, you got to wear those special glasses, you know, so you
you.
don't
Yeah,
get.
we get those.
But
Actually, it's not a bad idea.
you know, it's like, oh, I don't know what you'd put on the TV, but
Yeah.
maybe some Zen or something.
Some
you know.
scenery, like
Yeah.
you're going through the mountains.
There
and
you
the
go. Yeah,
ocean.
something just to kind of take your mind off what your mouth is going through.
Right,
You know, kind of
right.
get rid of some of that anxiety a lot of people have. So.
Yeah.
Well, I'd like to say some of that. I don't know if that's good for a closing remark, but we make it look easy, but you're actually cutting in somebody's head.
Yeah.
So, and you can damage someone, especially if they move because of X, Y, Z reasons.
Yeah.
So, and we make the people feel very comfortable, even sometimes
you do.
when it's really difficult. And yet, so if you're distracted and you're moving your head.
Oh, that's a good point. That's a good point. Yeah.
And sometimes I remember when I first started out and I hired my first dental assistant, and she was there for, I don't know, a few weeks or I don't know. And then my patient, I'm taking some teeth out, my patient is having a hard time. And then my assistant, because of the blood, she's about to faint.
Oh no.
So now I have to handle. So it's not. If you move while we have something.
Yeah.
You're watching. That could
Yeah,
be a little
that
bit
could
of-
be a little problem.
Can
I
you
got
imagine
it.
watching a scary movie?
Oh no.
No, that we wouldn't.
Yeah, that would be bad. That would be bad.
No,
All
we're
right.
trying to create calm.
Yeah. So again, we want to thank our guests from Family Dental Care, and please check out their website at familydentalcare.com. And they will definitely take care of you, whether you have insurance. They'll help you navigate all the avenues, whether you have insurance or Medicare. So
That's
thank
right.
you guys for coming in, and thank you for sponsoring us as always.
Thank you very much.
All right.
Thank you.
Good night, Chesty, wherever you are.
Hoorah.
Hoorah.